Making local news tonight, there have been 21 opioid overdoses in the past 36 hours in Springfield. 2 of those individuals have died. That string of overdoses led to an emergency meeting of city officials yesterday. At that meeting, Springfield Fire Chief David Pennington called in local first responders to discuss working on neighborhood surveillance and creating a community dialogue. Our David Chasanoff has been getting reaction from local leaders all about this. David, what did Chief Pennington have to say when he wants to open up that dialogue?
Yeah, well, he wants those conversations to be effective. He says telling people to stop using drugs won't do much.
Those that are in our community who are using drugs, while we want them to get off of the drugs, many of them aren't ready to do that.
Chief Pennington says this knowing addiction is a disease.
We would rather work proactively with them to get it to a positive solution than to respond to them when they're not breathing.
Working proactively includes not relying on Narcan.
Narcan is a tool, it's not the solution to this problem. So it's going to have to take a more collaborative community approach to deal with addiction.
Mayor Ken McClure says the city has to get on top of this problem.
Are we losing the battle? No, but we are identifying the problems and we're trying to figure out the best way to deal with those problems.
McClure says the overdoses had one thing in common.
All having to do presumably with fentanyl in heroin. That's significant. To have that amount, any overdoses is uncalled for.
Addiction recovery specialist David Stoker says fentanyl can be deadly.
Typically, it takes about 5 to 15 minutes after somebody injects heroin before they overdose. With fentanyl, people sometimes don't even make it through the shot. They still have a syringe in their arm.
Stoker believes fentanyl strips would help drug users.
If somebody were to buy methamphetamine, heroin, they could sit there and test it to ensure that there's no fentanyl in the supply that they got.
His Better Life and Recovery team is currently trying to make this available.
Unfortunately, that's something we're out of, and we're trying to do some fundraising so we can get another batch of them in.
In the meantime, Stoker has some harm reduction tips people should know.
Number 1, don't ever use by yourself because you can't give Narcan to yourself. Number 2, don't ever use behind a locked door because somebody may not find you until it's too late.
He says if anybody needs help over the weekend,
Preferred Family Healthcare will have somebody there 24/7 that can supply them with Narcan. They'll also have the ability, whether it's a male or female, to bring somebody in and get them assessed then and there immediately.
Now, Preferred Family Healthcare is at 2415 West Catalpa Street. Stoker says they will provide Narcan free of charge.